Understanding the risk factors for diabetes is crucial for both prevention and management of the condition. Diabetes, particularly type 2 diabetes, is influenced by a range of factors, many of which can be modified or managed to reduce the likelihood of developing the disease. Here's an in-depth look at the key risk factors associated with diabetes. 1. Age is a significant risk factor for developing diabetes. As individuals grow older, the risk of type 2 diabetes increases. This is partly because, as people age, their bodies become less efficient at processing glucose, and there may be a gradual decline in insulin sensitivity. Additionally, older adults may experience changes in metabolism, physical activity levels, and weight that contribute to an increased risk of diabetes. The prevalence of diabetes rises sharply after age 45, and by the age of 65, many individuals are either managing diabetes or are at high risk for developing it. 2. Family history. Genetics play a critical role in the likelihood of developing diabetes. If you have a family history of diabetes, particularly if close relatives like parents or siblings have the condition, you are at a higher risk of developing diabetes yourself. This familial risk is due to shared genetic factors that influence insulin production, glucose metabolism, and overall risk for the disease. Family history can provide an early warning and motivate individuals to take preventative measures, such as adopting a healthier lifestyle and getting regular checkups. 3. Race, ethnicity. Certain racial and ethnic groups are at higher risk of developing diabetes compared to others. Studies have shown that African Americans, Hispanic Americans, Native Americans, and Asian Americans have a greater likelihood of developing type 2 diabetes than Caucasian Americans. This increased risk can be attributed to a combination of genetic predispositions, lifestyle factors, and socioeconomic conditions. For instance, cultural dietary patterns and lower rates of physical activity in some communities can contribute to higher diabetes rates. 4. Obesity. Obesity is one of the most significant risk factors for type 2 diabetes. Excess body fat, particularly abdominal fat, contributes to insulin resistance, where the body's cells do not respond effectively to insulin. This leads to higher blood glucose levels and eventually diabetes. Obesity is often linked to poor dietary habits, lack of physical activity, and genetic predispositions. Managing weight through a balanced diet and regular exercise is crucial in preventing and managing diabetes. 5. Physical inactivity. A sedentary lifestyle is another major risk factor for diabetes. Regular physical activity helps maintain a healthy weight, improves insulin sensitivity, and assists in regulating blood glucose levels. Inactivity, on the other hand, contributes to weight gain and increased insulin resistance. People who do not engage in regular physical exercise are more likely to develop type 2 diabetes. Incorporating physical activity into daily routines, such as walking, biking, or swimming, can significantly reduce the risk of diabetes. 6. Some medications can increase the risk of developing diabetes. Corticosteroids, commonly used to treat inflammatory conditions, are known to raise blood glucose levels and may lead to diabetes, especially with long-term use. Other medications, such as certain antipsychotics and some types of blood pressure drugs, can also have an impact on glucose metabolism. If you are prescribed medications that may affect your risk for diabetes, it is important to discuss these concerns with your healthcare provider and explore alternative treatments if possible. 7. Certain medical conditions can predispose individuals to diabetes. For example, polycystic ovary syndrome, PCOS, is a hormonal disorder that can increase the risk of type 2 diabetes. PCOS often involves insulin resistance, which can lead to higher blood glucose levels and eventually diabetes. Other conditions, such as hypertension and high cholesterol, are often associated with an increased risk of diabetes. Managing these conditions effectively through lifestyle changes and medical treatment can help reduce the risk of developing diabetes. Additional considerations. Aside from the primary risk factors listed, there are other considerations that can influence the likelihood of developing diabetes. These include 1. Dietary habits. Diets high in processed foods, sugars, and unhealthy fats can contribute to weight gain and insulin resistance. Conversely, a diet rich in whole grains, lean proteins, fruits, and vegetables can help prevent diabetes. 2. Sleep patterns. Poor sleep quality and sleep disorders such as sleep apnea have been linked to an increased risk of type 2 diabetes. Adequate restorative sleep is important for maintaining healthy glucose levels. 3. Stress levels. Chronic stress can affect blood glucose levels and insulin sensitivity. Managing stress through techniques like mindfulness, exercise, and therapy can have a positive impact on diabetes risk. 4. Socioeconomic factors. Socioeconomic status can influence access to healthy foods, opportunities for physical activity, and healthcare services. Lower socioeconomic status is associated with higher diabetes risk due to limited resources and support.